Welcome, everyone. Thank you for joining the second webinar in our series on innovating mental health. My name is Dr. John Patenya, and I'm the Director of U.S. Mental Health Programs at HealthRight International. For over 20 years, HealthRight has delivered community-based mental health services using a step care model for a wide range of marginalized and vulnerable populations in low-income countries. Our current programs in Kenya, Uganda, and Ukraine have reduced symptoms of depression, anxiety, and PTSD for survivors of violence, refugees, and postpartum women. Last year, HealthRight launched the U.S. mental health program, building on our global mental health experience to implement an innovative, low-cost, and scalable step care approach to mental health adapted for underserved populations in the United States. Our first webinar examined the partnerships and infrastructure essential to implementing these kinds of interventions. And today we shift the focus to community voices. I'm excited to welcome mental health advocates and youth leaders to share their insights into peer-led approaches and what meaningful, community-centered mental health solutions can look like in practice. Our step care model spans the full continuum of mental health care, ensuring timely and appropriate support at each stage of need, starting with psychoeducation, leading to early prevention and screening, low intensity treatment, community-based support and targeted referrals, and aftercare delivered through digital tools. The core of our work is what we call low intensity psychological interventions, which intentionally utilize non mental health specialists in providing brief, targeted, low touch mental health support. These evidence based and World Health Organization endorsed interventions are peer led, usually community health workers or other trusted members in the community that deliver care. In our global work, we found that peer-led mental health interventions break down some of the barriers to accessing and utilizing mental health services. Now, before the panelists introduce themselves, let's start with a quick poll for the audience. So if we could launch the poll. When you hear mental health support, what comes to mind first? Does it mean talking to someone you know personally, seeking professional help, self-care, or coping skills, or that you're not sure, and that's totally okay. And as we wait for responses, I'd like to emphasize that this panel is designed to be interactive. So please put your questions and comments into the chat. My colleague will be monitoring the conversation, and our panelists have expressed how excited they are to hear from audience members. All right, so let's give it a few more minutes for the chat or for the poll. All right, so we can end the poll. And it looks like majority around when you hear mental health support around professional help, so that could be licensed mental health professionals. Part of our conversation today is to explore what would it look like to incorporate and integrate peer-led support programs into the mental health spectrum. All right, so now I'm going to invite our panelists to introduce themselves. So please share your name, your affiliation, the voice or perspective that you're bringing, and what does mental health mean to you? So first, let's start with Tabitha Ellis.
Hi, everyone. Um, my name is Tabitha Ellis. I am someone who is a person with lived experience. I'm also a global health advocate and an elected representative of the Americas for the Global Mental Health Action Network's Advisory Leadership Group.
Thanks, Tabitha. And what does mental health mean to you?
Yes, sorry. Uh, Mental health to me is really an encompassing embodiment of truth in the moment and the lived reality that somebody is going through. Being able to not only live authentically and to be able to share that and move through it versus ignoring it and causing destruction from personal experience. Being able to have the skill set and the support and tools to be able to move through what you are going through to have a better life, is what we're all here for, to help and embody and embolden and empower and inspire people for.
Thank you, Tabitha. Sasha Penn.
Good evening, everyone. My name is Sasha Penn. I'm a third year psychology major with a concentration in mental health from Memphis, Tennessee, and I attend Spelman College. I will be presenting from the voice of a youth mental health advocate, as well as a youth that's within the Black community, presenting the Black voice as well. And what mental health means to me is I always say that mental health does not have an age. So at any age you experience mental health, you have mental health. Everybody's born with it, right? So understanding the importance of that, knowing how to take care of your mental health through wellness practices, and what makes it better for you in order to support your mental health through different activities, walks of life, whatever it takes in order for someone to put their mental health first is what it means to me. Yes.
Thank you, Sasha. Shreya Kanchala.
Hi, my name's Shreya, and I'm affiliated with the Technology and Adolescent and Mental Wellness Youth Advisory Board. Short form is TAM Youth Advisory Board, and I am representing as like an adolescent mental health advocate. And mental health to me, I think the first words that kind of come to my mind when I think of mental health is like emotion and feeling. And I think mental health is kind of the ability to sit with what I'm feeling with without pretending that it's not there. And I think it's knowing that I can struggle and still be worthy. And I feel like having that expectation of, not having the expectation of I have to be happy all the time or I have to feel this way all the time, and just really being comfortable with expressing your own feelings to yourself.
And now Shreya Raghavendra.
Hi, my name is also Shreya. I'm based out of New Jersey and I'm currently a junior in high school. I am also a part of the Technology and Mental Wellness Youth Advisory Board, and I'm a huge mental health advocate. What mental health means to me is your emotional well being mainly, and like kind of the balance in your mind that and the steps that you can take to create that balance in your mind. I think it's super important, and it's definitely something that you develop more and more as you grow. And it's also super important to have a good emotional support group and to have the access to resources that people need in order to create that balance, and to be able to figure out if there's something wrong or if they need help in an avenue. And definitely I'm a super strong advocate for it. So that's what mental health means to me.
Thank you, Shreya R. So to get the conversation going, and we the panelists and I we've developed these questions, and we want this to be as natural of conversation as possible. So I invite audience members to put in your own questions into the chat, but we do have a few questions set up. But my first question is, from your perspective or lived experience, what are the most pressing mental health challenges facing your community right now? And how are members of your community responding to those challenges that show up? Sasha, maybe you could get us started.
Yes, of course. I would say first and foremost, there is a stigma within the Black community in regards to seeking mental health support. Um, I've seen it across family members, friends, peers, and it has been a struggle knowing that I have friends in my life where they come to me for personal problems and issues, and I tell them, I'm like, look, I'm not a professional, I'm not licensed. I think that there are some things that you could get help with that a professional could help you with, and they feel almost embarrassed to do so. Um, and with that being said, it declines their mental health and they put themselves in a position to where they may be more of hindrance to a mental health disorder such as depression or anxiety because they didn't seek out that mental health treatment. So I would say that would be the number one thing that I see in my community that is affecting it in terms of mental health. And probably just in general speaking and talking about it. I think a lot of the time I'm also an advocate for Black men's mental health as well. I've seen it in my family, not being able to speak about how they are feeling in the moment, the lack of emotional intelligence, and the anger and the frustration and the sadness being taken on in ways that are unhealthy, right? So knowing that it's not common to actually voice how you feel, instead suppress it and to let it build up over time is something that I also see in my community that has affected how we handle mental health, how we go about our day-to-day lives, and if we are comfortable enough to even speak on how we feel, to even be truthful, to have someone to tell them how we feel and to support us along the way. Support is also a thing as well, not having people to support us, to build us up, to know the right things to say. A lot of the time, the wrong things are said, things that are meant to help, but honestly do harm. Because a lot of people aren't educated on the topic of mental health within the Black community, and it is looked down upon. So I would say that.
So like as a high schooler, what I notice around my peers and the people that I surround myself around is there's a lot of fear of failure and there's a lot of academic pressure that comes with, especially I'm in my junior year right now, and I think I see it now more than ever, the pressure that people put on themselves to be the best, to get the best grades, to have the best stats. It's honestly a little concerning to see the lens that people go to be number one. And I think this also can create a lot of isolation where you don't have a proper support group. And in the midst of trying to keep everything to yourself and wanting to be number one, you aren't able to talk to people around you and confer and be able to like talk about your emotions with your own friends or your own family. And so that creates isolation, which I think can really be detrimental to everyone's mental health. And in the long term, it can have a really large impact where with trust issues, it can build or destroy your trust and your relationship with other people. And I think those are some of the most pressing mental health issues that I see, especially in high school, and that I've noticed growing in the past 3 years that I've been in high school.
Yeah, and I think adding on to that, I think social media also can have an aspect on that. So Shreya, for example, was kind of talking about how high schoolers, feel like they need to achieve the most and they need to be the best that they can. And when you go on social media and you see a, people who are, saying, I got accepted into these colleges and these are my stats, and not even just like academic related, this can even be, for example, like working out, you can be like, um, for example, like influencers posting about their workout routines. And you'll kind of, as like, I feel like I've seen my peers, be like, oh, like I want to be like them, right? This seems what I'm supposed to look like or what I should look like. And I think, and oftentimes social media can be very unrealistic in those standards. And I think that makes it kind of difficult, because our brains kind of get wired into thinking that that's what's correct. And another thing I think is I've seen kind of in the Asian community, it's been kind of hard for people to admit that they need professional help. And because I feel like therapy has, especially in my community, is kind of like taboo. And it's like, if you need therapy, then you're like different and something might be wrong with you. And yeah, I think those are kind of like two important things in my community.
Something I'd like to add, when Sasha was talking about like the stigma that's around it, I think that is probably one of the most prevalent amongst just our generations combined. Something that has really kind of emerged out of that social media context and more of the younger generation is this kind of cringe culture, where everyone's like, oh, that's so cringe, like, don't do that. But really, that has come out of like people showing their emotion. Like, it's cringe to be upset or to speak loudly or go after your dreams or show what you're interested in. And that is something I can say that I didn't have to go through when I was in high school. And that just adds this whole layer of that kind of perfectionism in communities that they feel like they one can't share it, but also that they can't show it either, which as Sasha again kind of laid out for us, when you're suppressing your emotion, positive or negative, that is never something down the line that is helpful to anybody who's on the other end of that. Another thing I really think is really prevalent from my perspective and talking with different spaces is just the inequities and barriers to access. And that could that could be whether it's coming from a space of social determinants or lack of knowledge, benefits being described to people at jobs, the resources, the environment is very stretched thin for healthcare professionals. So it's not only trying to find one, but it's trying to find one that has time and availability when you need it, when you finally do get the courage to get there and you've gotten that peer support to get there. But it's also, from my own experience, I have had to change people multiple times in therapy because there also is an element of trying to find somebody who understands you, where when you're coming with a moment in your life that feels very crisis filled or is crisis filled, there is a foundation of feeling like you have to provide justification of why you feel anxiety or why you feel suicidal or why you're upset or you're depressed. And with a statistic from the WHO that, globally over 1 billion people have just those two things, um, that is a lot of people who are walking around in states of survival versus in of thriving. But then when you do go to a professional and the lack of tools to communicate with somebody and be curious versus kind of judgmental is what it comes off as, um, that can really hinder somebody. From my lived experience going to that and finding a lot of people who kind of looked at me and was like, I don't understand why you're depressed. Um, and then having to kind of justify why I was there and why I was depressed. And um, at the time going through something very kind of impactful, it actually caused me to go the opposite way. And we also have a lot of statistics that most of the time when people do end up, committing suicide or, harming themselves, it's directly after negative situations like that. So I think there's just a lot of inequity barriers and tools that are, just underdeveloped and underfunded.
I agree. Can I add something else to what Tabitha said? Okay, great. So I also agree. In terms of resources, I also have noticed that people really, yes, do not know how to respond, and that's the first issue, right? When met with the situation, when a peer is coming to them about having suicide ideation, a lot of the time, the first thing people want to say is like, "Well, I'd be sad if you'd leave this earth," and whatnot. But they say, "I am mental health. I'm mental health first aid certified, and also in suicide prevention as well." And it is said within those that you really should not be talking about how you feel in that situation, right? A lot of the time, a response is not needed. It's more so like, "Hey, I'm here for you. I want to listen to you." And even if you're not, more specifically, if you are not licensed, it is advised to not give advice, right? So it's more advised to just listen, to sit there and to hear what the person has to say. It's a very jarring situation when someone comes to you like that. You really don't know what to do, especially if you've never been met with it before. But I think that is an issue, and I would encourage different communities and different spaces to provide that mental health resources, those resources in order for them to know how to respond in situations like that. Just how we have a lot of DEI training and stuff of that nature in different spaces, I would encourage also a lot of mental health training as well. So therefore, when someone is presented with a situation of that sort, as Tabitha was saying, that they would be able to respond in a manner that is conducive for them and the person they are talking to as well. Yeah.
Thank you, everyone. And a few things that the themes that are coming out here is that One, there's this level of there's a challenge to even talk about mental health. It sounds like from kind of all four of your perspectives and kind of the communities that you're in. One, it's hard to talk about mental health, and then if you are able to talk to someone, they may not be equipped with the right kind of skills or kind of know what to say. So to kind of dovetail a little bit on the poll that I asked the audience was, who for the audience members, who do you go when you hear mental health, kind of who do you go to? I'm curious for the four of you, when you for your community members and for your peers, who do they go to? Is it a mental health professional? Is it a faith or spiritual leader? Is it a trusted member in the community? Is it kind of peers among yourselves? Who is it that you go to and your colleagues and community members go to?
So in my community, what I've noticed is, like I mentioned earlier, especially from my peers and the people I surround myself with, they don't really talk to each other about their own problems. It's kind of maybe stigmatized and they just don't do it. But I do notice that a lot of people go online for personal problems, which I honestly I don't know if that's like always the best idea, but sometimes there's really no other choice. And there's so many resources online because there are open forums, there's social media itself, and there are places where people can go to relieve of their personal problems, get advice back, usually from strangers, but advice nonetheless. And I think what I've noticed is there are also like AI platforms which people have went on to express their own personal problems, and there are definitely a lot of detrimental impacts because of it. But at the same time, I think if they do use better resources and better places to go to express their personal problems, I think it can help them more than harm them. Yeah.
Um, I would say that although it is stigmatized in my community to go to each other and their peers, that's what I see the most, if I'm being honest. Um, like I mentioned before, I have a lot of friends and a lot of peers. Like I'll just get random phone calls during the day. It's not even, hey, how are you? It's just straight into it, right? This is what happened today, X, Y, and Z. And I thank God that I'm able to handle situations like that. But I even find myself going to my parents. I go to my mother a lot for a lot of things that I need. I go to my grandparents. I go to the trusted people in my life that I know are not going to judge me for what I'm going to say, right? They know that I've experienced mental health serious issues since I was in middle school, right? So they know how to properly handle those situations. Of course, they had to learn over time. It's not something they were used to or knew how to handle. But once they understood how to handle it properly, it was helpful for both me and them. But I do see within the Black community, even as a college student, I see a lot of the time that my peers, we go to each other. And I think that seeking out professional mental health counseling is the last resort, if I'm being honest, which I would hate for it to be, but that's the truth, is that we would rather go to each other than to a professional who could really help in a different way, provide answers that I probably can't provide or that my other peers probably can't provide as well.
Thank you. So I wanted to bring up there's these kind of themes coming up from both of your responses that in and Shreya R, just to confirm, when you mentioned kind of online support, is that in reference to social media platforms, things like Reddit or kind of AI and chat? Is that
Yeah, yeah, that's what I meant.
so I'm curious, and I would love actually the audience, our audience members to kind of put into the chat. Have you used online platforms like Reddit or kind of social media platforms, or kind of even the use of AI and kind of chat and everything for mental health support? And I think that the theme that kind of Sasha kind of brings in as well, there's these different kind of levels to seeking support, advice, help. And in Australia, it sounds like one layer is like, well, are there other online community members that I can kind of ask similar questions or kind of find these kind of advice. And Sasha, you're mentioning that component of trust, of kind of people you can trust in your life. Tabitha and Shreya K, what is that like for you in terms of like the levels before reaching a mental health professional?
My experience has been very similar to Sasha. It's been very much um, going to peers, going to friends, or family members. But the underlining importance of that is going to the person that they trust the most, whomever that is for that person. Um, and sometimes you get one shot, and it's one person that person might have, and other people have a wider support network. But I have always gone to my best friend. She is who I talk to. But I can say there are even times where I have tried to seek out other things. I've tried to go to church, tried to go to um, sports games, just anything that made me feel underlining less alone, to be seen, to feel heard, and to feel like valued and supported in whatever is going on at the time. But I can 100% agree with Sasha that usually by time I've gotten to a professional, it's kind of last stitched effort at that point.
Yeah, I agree with Sasha and Tabitha on the fact that I think going for professional help is kind of the last step. I think firstly because I think it like can be expensive, and also example like for my age or people like around my age when we're in like high school, middle school, in order to get professional help, you need to like consult with your parents about that. And I think that can be a huge barrier as well because a lot of parents might not agree with getting professional help. They don't think it's necessary. Um, and for me, and I noticed like a lot of my peers, one, definitely social media, like Shreya R said, but also just like the notes app, like just writing down your feelings. This is something that I do as well. If I just like I'm not having a good day, I'll just go write down why I'm not having a good day and what I can do differently tomorrow. Um, and what really, like for example, if I was annoyed, like what annoyed me that day. Um, and yeah, I think the other panelists kind of mentioned the different ideas, but yeah, to add on, I would definitely say the Notes app.
Thank you all. And I see a question in the chat here. So I'm going to read it out loud. And so it's how can social media be structured well to provide information to people in need? And I'm wondering actually with Shreya R and Shreya K, it's, particularly given your involvement with the technology and adolescent mental health program, is that something that your group talks about in TAM? Um, or kind of how you think social media can be used for good?
So I think a big part of what we talk about is definitely what needs to be measured in order to create or to change social media in a way where it helps rather than like distracts. Um, so we measure things like isolation, sleep schedules, and just overall like ability to stay off of your phone or however long people are on their phone, because the one of the main things that we do focus on is not just how long someone is on social media or like on a device. It's really what they're using it for, because there's so many different uses nowadays. There's work, there's personal, there's business, there's everything, right? So it depends what people are using it on, and so we think about a lot of different barriers and a lot of different parts about social media and technology that need to be taken into account to structure social media in a way where it can really help people.
Yeah, I think adding on to that, recently we were actually talking kind of about AI, and we were talking about, yes, like the fact that AI can be helpful, but how it can also kind of have a negative aspect as well, because we've kind of noticed how AI has a tendency to kind of agree with things that you say. So we've been talking about how there have been cases of like suicides through AI, because like the person was asking for help, but it wasn't really providing the help that I needed. It was just being like positive, like, yes, like do this to yourself, or, so um, I feel like AI could be restructured in a way that it can't always have the tendency to, I guess, like tell you to do something.
And I see a comment in the chat that kind of the use of AI in mental health in a public health course where it seems that a lot of like a huge not only limitation but a huge red flag in terms of safety concerns is the limitation that AI or kind of other sources that may not be able to provide kind of proper help. It's more around the comment saying kind of reassuring feelings rather than helping someone with their mental health. And so again, the themes here around how do we equip different levels of support, right? Because I recognize, right, that it would be disingenuous for me to say all social media is bad or all AI is bad, right? But like, how can we use these different levels of support, knowing that community members do go to resources like that? I want to kind of,
I would love to add to that if
yeah,
that's
Tabitha, go
okay.
ahead. Yeah.
There's a really good example. I mean, it's in the kind of more beginning stages, but it's one of the only kind of social platforms that we have that's doing it. But Pinterest has actually been really kind of a forerunner in trying to help with mental wellness and mental well-being. And they've structured their platform to actually be able to pick up on individuals' positive interactions and boost that in the algorithm that they're seeing versus negative content or political content or kind of news outlets, so that when you're getting on Pinterest specifically, you're leaving with a more boosted, positive mental well being versus when, I personally go on Instagram, it can be just chaos everywhere. And they've also structured things about making sure that people's focus is in alignment and off of their phone, as Shreya R was kind of saying, where if you're under a certain age and you're on Pinterest during school hours, a box actually comes up and kind of is just a gentle reminder that they love you, they want you to be on the app, they're excited that you're there, but to focus on your school and that to come back afterwards. It's little things like that that I think we're moving in a right direction for using that algorithm for a positive and to create impactful positive change rather than kind of just feeding into the social media black hole of anything that's put out there and kind of the overconsumption of whatever it may be on your feed.
I am hopeful that as a society we will develop these safe spaces, like whether it's Pinterest or kind of other online platforms that there is a movement for good and support. I want to kind of pivot just a little bit and ask our panelists here. We've been talking about peer-led support, and all of you have mentioned in many cases, formal mental health services is actually at the last step or kind of toward the end of kind of the journey of seeking mental health support. I would love to kind of dig a little deeper in terms of what does peer-led support mean for the four of you? Like we use the term peer-led support. What does that mean to you? What what do you wish that peers knew about mental health, that they need to be equipped with either the skills or the knowledge, or what are those components that would make a peer-led kind of approach helpful for you and your communities?
I think in my community, I think we should normalize like being vulnerable and being able to talk to each other. I think that's really important. That also creates a really safe space where we can go to each other, um, and I think peerless support can also be living through shared experiences and being able to talk about them freely, and being able to give your input, but in like a non-judgmental way where someone also can accept it and understand if they need like more help, or if they just need to expand their like support group. And yeah, so to me, in high school especially, I think um, having people that have lived through experiences with you or shared the same experiences that you as you, and moreover being able to talk about them is super important. And I think that would lead us to definitely lean on each other a little bit more.
I definitely agree with Shreya R. In two regards. One being that having people, like she said, that understand you and have been through what you are going through or have been through is important. So, encouraging schools and other organizations to create those safe spaces for people. But also, I had to learn throughout my mental health journey that not everyone's going to understand me, right? So I will have a lot of the time when I was going through my mental health problems in middle school and high school, there was no one. I knew no one who was going through what I was going through. Like I would talk to my friends about it and they would have nothing to say because they didn't really understand my point of view, my perspective. But them just letting me know that they were there was enough, right? So when I think about peer-led support, I think about presence. Honestly, I think about presence. The people in my life, they know me. They know like sometimes I don't want solutions. I don't want answers. Sometimes I just want you to be present with me. I want you to hold me. I want you to tell me it's going to be okay. That's what I think about when I think about peer-led support is knowing that someone is next to you and in your corner 24/7, willing to listen to you, willing to hold your hand through whatever obstacle you may be facing. Because a lot of the time, I wouldn't even want to talk to anybody thinking that they're not going to understand me. They're going to judge me, right? But also knowing that there are people in my life who do care truly and honestly about me and about my well-being. So knowing that they were in my corner was enough for me, honestly. And having someone to understand me is when I went to go seek that professional mental health counseling, right? But before that step was being able to be comfortable and knowing that there are people that are willing to sit by my side and listen to me and hold my hand and catch my tears, right? So I don't think peer-led support always has to be something verbal. I really do and honestly do think that presence means a lot. When I had a mental health situation that happened, maybe like around this time last year, all I did was because I'm currently away from my home. I'm in Atlanta right now, and I did have to travel home for it. However, when I wasn't at home, I couldn't get on a flight as soon as possible. I just told my cousin who lives here and my friend, I was like, can y'all just sit with me? Just be here with me because I don't think I can trust myself, right? So, and them just being with me did enough, honestly. And I was able to restrain myself from doing anything or making those bad thoughts turn into something more. So I would say presence.
Thank you for saying that. Tabitha or Shreya K.
Honestly, I think presence is one of the biggest things when it comes to peer led. I think Sasha put that absolutely perfect. There's a lot of time where most people just truly want to know that they're not alone, and to know that they're not the only one, and to know that they're being seen and valued and supported in any way. And sometimes, as Sasha said, that looks like somebody just sitting next to you and just being there with you, and that presence being in solidarity with you. And other times that's listening, talking it out, or saying, hey, that I'm so sorry you're going through that. Have you thought about talking to so and so, or going to look at this, or let me help you? Like, is that something you're interested? I'll help you. Like, I think there's so much power in just community and connection. And I think when we talk about kind of some of the things we've spoken about earlier, social media, like this cringe culture type of situation going on. There's a lot of space that's creating silos for people to be sitting in, and that can the disconnect of just humanity and the fact that nobody is perfect. We all go through a lot of different things. As we said earlier, no one is untouched with mental wellness or mental health, and um, sharing those experiences, being vulnerable and being willing to share them openly is the thing that connects us the most, but can sometimes be the thing that is dividing us when you have things like social media that we're fixated on instead of the person in front of us, as Sasha put it very wonderfly, is, presence.
Yeah, absolutely. And I think what makes peer-led just like a really very complicated in the first place is that, for example, peer-led could also be like, for example, going to a therapist, right? But for example, let's say you're trying to go to your first therapist meeting, right? They don't really know you that well. And yes, they're going to get to know you, but when you just need like that help right then and there, and they might be a person to like be like, oh, like I hope you feel better. They might comfort you, but you don't really know them that well. And even if you're trying to go to a friend, right? What if you don't really know that? Like maybe you don't feel comfortable sharing that with your friend because you don't know how close you are with them, you know? And I think that's what makes it like really complicated. And even if you do have a friend that you feel very close with, they might not understand it. So like Sasha said, I think the presence is also very important. And I think we could also use the question that we were talking about before, kind of like the social media, how can social media be restructured? And I think AI is also doing this already. But whenever you're giving them a prompt or being like, this is how I'm feeling, they could kind of just comfort you. And I think that's what they kind of do. They're like, I'm not a specialist, but I hope you feel better. So I think having more platforms like that are just there to comfort you, can really be helpful.
Thank you,
Mhm.
everyone.
Oh, I'm
Oh,
sorry.
sorry.
No,
Sorry,
I was
sorry.
just gonna
Go
add
ahead,
one more quick thing.
please.
I was gonna say empathy as well. I've noticed that empathy has gone a long way with me and my peers and my mental health journey. Um, like we just said, not understanding is something that you're gonna come across people who don't understand, but someone who can be empathetic towards you and your situation, not just kind of throw it under the rug. I know something that I see a lot in my community, within the Black men in my community, is I'll have friends guy friends who would come to me and they'll express things to me, mental health wise, and they'll say that they went to their friend and their friend was just like, like we men, we go through that. It's okay. Like, like you're gonna get through it. Like, just shake it off, bro. That's not empathy, right? Empathy is being able to sit with somebody and be like, I hear you. I may not understand you, but I hear you and I empathize with you and I feel for your situation and I want to hear you. I want to listen to you. I want you to pour out what is going on in your life to me, even if I don't understand. So I think empathy is a big portion of that as well.
Thank you, everyone. And just to be mindful of time here, I'm going to ask my last question for our panelists. I'll invite all our panelists to speak as we kind of close out the session. Um, so for the past, and again, for me, it's like, I can't believe it's been 45 minutes already. I think the conversation went by so quickly. Um, the kind of thing that's sticking in my mind right now, and this is a question I want to ask all of our panelists. Um, how do organizations, so when I say organizations, that includes community-based organizations, faith-based organizations, academic institutions, hospital settings, healthcare settings, how do these organizations support um, peer-led mental health programs? Balancing, as we know, there's going to be a lot to balance here. Kind of the parts that you all mentioned, having peer-led peer-led programs, having presence and empathy and kind of being there for the other person, balanced with how an organization can support kind of those programs. what can organizations do? What needs to be done? I'm going to invite Tabitha to go first, and then I'll call all of our panelists.
Something that's coming up, especially when you're talking about, school or faith organizations or just community centers, is really putting passion over prescription. And what I mean by that is when you start looking at what is that community of people engaged with and passionate about. And when you start at of intervention, early intervention, especially if they're younger, and you weave in mental health strategies within the passion of soccer or knitting or whatever it may be, it can really start to ingrain and reform the stigma that we currently have. It gets people talking about it more. It aids people with tools already. Because I think a big issue that we're having is we overspend on crisis reaction versus um, really looking for that early intervention, early integration within the community. So when you have people really going through it, and we know just statistically and probably from all of our experiences, middle school and high school is a very tough time in people's lives. There's a lot that's going on, not only physically, emotionally, but at home, and to being able to weave that into the passion around whatever community you're in can be so helpful. Now, when it comes to the workplace, I think it's the same thing. It's really that making sure that we're looking at um, that early intervention, the resilience, the acknowledgement, and resources guide, letting people know what their benefits are, having somebody there if you have questions about benefits. How do you access this? What do we provide? How are we as a community um, structuring our organization for the well-being of our employees versus kind of saying that, hey, it's on you. The climate has changed. The climate is very stressful right now. Job security is down, finances are down because of, skyrocketing costs. And I think that it's really going to take reform on how we look at the community as a whole versus looking at it as it's your responsibility or it's their responsibility, and instead look at how are we as a community emboldening and supporting each other so that we don't have these crisis reactions that we have to deal with, and instead providing the support before it becomes an issue.
Thank you, Tabitha. Shreya K.
Um, I think the first thing that's really important that comes to my mind first is really like having boundaries. Um, I know if it's like if you want to become a peer leader, I think obviously empathy is really important as we discussed, but I don't think you should just become a peer leader because you think you're empathetic, right? I think you need to be able to actively listen, you need to maintain boundaries, you need to make sure that you keep whoever's telling you, you have to just keep like that trust between you and that person, and that person should trust you that you are not going to tell anyone else about their problems. And I think another thing for the program that should be very important is having actual licensed mental health professionals to kind of guide them through the process of it. um, and also just having like kind of like a clear path of what you want. um, I think peer-led can be very helpful, but it could also be messy. Like not messy in the sense that there can be many issues because you don't really know like if the person is trying to get training for peer-led. For example, my high school, a high school student in my school decided to start a youth mental health program. So it also included like peer-led students. So students would have to go to training. The training was about 3 weeks, twice a week. Um, and it worked out very well. But I think a main part for why it worked out really well is that in our mental health center, we have three mental health professionals who kind of run who run the center essentially. So they were the main people that were doing the training. And I think with their like support and them establishing, what boundaries we're supposed to have with the students, it really helped the program to succeed.
Thank you. Shreya R.
I completely agree with Shrek K. Something that she mentioned was that she has access, or her school has three mental health professionals that kind of structure the whole thing, and that kind of makes it run smoother. Something that we don't have in my school, especially with peer led mental health support groups or just mental health support groups overall, is professionals. And so I think in my school, when we are talking about access to mental health support, it feels way too structured because the school is obviously trying their best and offering mental health support however they can. But to us, it just feels way too over monitored, over structured, and definitely doesn't create the safe space that we think we need in order to trust them with our issues and obviously our personal problems. And so I really do agree that in order for institutions and schools, especially, to be able to take it more chill and be able to offer that support that students need, they need to have access to mental health professionals and also not be too overbearing where students have to submit where they have to submit their mental health issues in a specific way, whereas they can just talk about it and they can get the support that they need in the right way, however they need it.
Thank you, Shreya. Sasha.
Yeah, so I'm gonna actually come from two different voices with this one. I loved what Shreya K and Shreya R said about resources, and I would say that um, a lot of the time people are attracted to things that are thrown in their face a lot, right? So when you're it's anything in America, right? When it comes to promotion, so when you're watching a commercial, you see a billboard and you see McDonald's on your TV, and you see McDonald's on the billboard, and you see all these things here and there, you're gonna be like, I'm hungry. I think I want McDonald's today, right? It's something psychological with that. So I think that even putting it out there, making sure that that's being promoted more than anything else, right? Creating those peer-led support groups within spaces and organizations and schools, but also making sure that those are the things that are being promoted the most. Because I think that we can have them, but if we don't promote them, they're just kind of sitting there, right? So even when it comes to like on my college campus, we have a whole bunch of mental health support groups. We have different psychological organizations and all those things. But I will talk to people and they'll be like, I didn't know that existed. I didn't know my counseling center existed until sophomore year, right? So, but that's because that's not something that's being blasted, not like other things are, right? So I would say that first and foremost. And then from a different voice, I am a believer in God, Jesus Christ. So I know for me, although I talk to my parents, although I talk to my peers a lot, my mental health has stayed stable because of my faith, and that's just the truth in that, right? At one point, I had faith, but I was relying on my parents and my peers, but my stability has come from the Lord. And I would say within faith-based organizations or groups, making sure that there is spaces for mental health practices and mental health peer-led support groups. Because I know for me, a lot of my community, a lot of the friends I speak about are the ones that are in faith, right? So the fact that I'm able to talk to people who not only are giving me a perspective of this is the reality of the situation, but this is what also the Lord says, that is what helps me a lot. So I encourage the faith-based organizations to lean into those peer-led support groups, right? Because a lot of the time there is a stigma within the Christian community. I can't necessarily speak to any other religion, but I know within the Christian community there is a stigma on mental health and how to handle it, right? But I know that one, being honest with yourself, being honest to the Lord about how you're feeling, and then taking the actions to help yourself and surround yourself with people who are also facing those same problems is important. So having those faith-based organizations, creating those groups, supporting those groups, and promoting, like I said, making sure that that's being blasted, right? So and this can be in any space. I know that I was a part of a panel at a Baptist church in December, and they have an actual mental health organization within the church that they promote 24/7. And there was a huge turnout there. And it was a lot of people who were in their 60s and 70s. And quite honestly, I know that that's around the age where it's like, oh, they don't really know how they feel about mental health and whatnot. And they were very much open to what I was saying. I was the youngest person in the room, to what I was saying and to what other people were saying surrounding mental health and what it means within the faith-based community. So that's the other voice I would give to it as well. But I would definitely say promoting it 110%, and then also making sure that you have that comfortability within those spaces to have those conversations as well.
Thank you, everyone. I was so I'm so excited about this conversation. I feel like we could keep talking more, because it really kind of highlights the point that mental health kind of care, especially within the US, there's so many barriers, so many challenges to accessing and utilizing care. And from what our panelist has mentioned around highlighting the kind of the preventative component, how to integrate that in existing workflows, how to promote it, how to be present and empathetic, how to recognize that peer-led means there's so many. There's a whole spectrum of peers that exist, that we need to really utilize and really support. Because at the end of the day, and I'm sure that this is something that we all agree with, at the end of the day, we want to increase mental health access for everyone. The World Health Organization says there's no health without mental health. And in my work, I believe that mental health integrates in all parts of life and in all kind of health conditions. So I'm so thankful for our four panelists, to not only bring your voices, but to have this to kind of reaffirm the importance of mental health and mental health care. In our last minute of our conversation today, I'm just going to share my screen one last time. Um, so as we wrap things up, I'm excited to share that the Health Right U.S. Mental Health Program, we have a few current active projects. One is evaluating our step care model, which is inclusive of peer-led models with justice-involved populations. We have a second project around piloting a specific peer-led intervention, which is called Problem Management Plus, with a community-based organization in central Pennsylvania that supports Nepali-speaking Bhutanese refugees. And lastly, we have a developing partnership with a community college based here in New York City that supports older adolescents and young adults. So while HealthRight is headquartered in New York City, we are open to all partnerships throughout the US. And if you have any interest in learning more, please feel free to contact me and reach out. Thank you, everyone. Thank you to our panelists. Thank you to our audience members who have joined, for joining us today. The third installment of our webinar series will be in late spring, so stay tuned for that. Thank you all.
Thank you, and thank you to the panelists.
Thank you
Very
for listening.
informative. Very informative. I'm so glad I joined.
John, would you be able to share like the three initiatives that you were talking about for partnerships, like through the Miller?
Yes, absolutely. I'll be sending a recording as well as kind of notes from our conversation today.
All right, great. Thank you so much. This was really wonderful. Thanks to all the panelists for sharing. To really enjoy the hearing about your lived experiences.
Thanks for inviting me. I thoroughly enjoyed it. It was great. It was a great discussion.
Thank you all. Our panelists, if you could stay on for just a couple minutes, for us to debrief, but I'm going to stop the recording.